Hi guys, it's Chloe and welcome back to my channel. But I recently went up to Hershey last week to see my Spina Bifida specialist, and I know some of y'all are anxiously awaiting for an update on that. So I figured I'd go ahead and give y'all an update. But for those of y'all that don't know, um, it is really hard to find care for adults with Spina Bifida. So to give you an idea, there are over 100+ clinics, but only 15 of them see adults, and this is one of them. So before I even get into Hershey, let's talk about the flight there. So we were supposed to take off at 3:14 in the afternoon and board at 2:45 in the afternoon. And we get there, and at 2:45 they start boarding and everything. And then the pilot comes out and tells the gate attendant to stop boarding. The plane is broken. So gate attendant goes on the intercom and tells everybody this, and he said that's all the info that they had for now, and that, they'd let us know of any other updates. The thing is that my first appointment of the day was at 7:30 in the morning, so if I didn't make it out that night, then I wasn't going to make it to my appointments, because there wasn't a flight that would get us there in time for my first appointment. So, and the thing is that we had no choice but to fly Delta, because the nearest airport to Hershey is Harrisburg, and it is so small that Delta is the only airline that flies to and from Atlanta to Harrisburg. And they only do 3 flights a day. And we were on the second to last flight of the day. And 10 minutes later, the gate person or whatever gets on the intercom and says that there's a flight from Oklahoma City that was 30 to 40 minutes away, and they were literally using the same exact aircraft that we were using. And all we had to do was go to their gate, which wasn't too far away, wait 30 to 40 minutes there. They were going to deplane everyone as quickly as they could, sanitize the plane, and turn it around for us to use. And we did that, and shout out to Delta for doing this, even though I don't drink, but they gave everyone on the flight that wanted it free alcoholic beverages for making us wait. And we landed, we got our luggage, got something to eat, went to the hotel, and then went to sleep. My first appointment of the day was an ultrasound on my kidneys and bladder at 7:30 in the morning. But we decided to go earlier because last time I had to get an ultrasound done, it took a while for us to be seen, and I had to go to the Pediatric Bone and Joint Institute, which was on the other end of the hall, for Spina Bifida clinic at 8 in the morning. And last time when I got done an ultrasound on my kidneys and bladder, it took a while for us to be seen. So we figured if we got there early, they'd take us early, and sure enough, they did. And then I went to the Pediatric Bone and Joint Institute for my Spina Bifida clinic appointment. So basically how clinic works is I went to the Pediatric Bone and Joint Institute. So you go to the location that they tell you to, and all the doctors come to you, and you just stay in your room, and they come and they visit you and they talk to you, see how you're doing, and then leave. And I had to fill out paperwork, but some of them were like surveys, but it was really hard for me to fill them out because I wasn't a resident of Pennsylvania, and it was all pertaining to sounded like it was pertaining to residents of Pennsylvania. But I don't think the people at the front desk realized that I was from out of state, because they probably just didn't think of that. A nurse comes, and she weighs me, and they do take height too. However, I stopped growing because I'm an adult, so there's that. And she then puts me in a room, and not even 2 minutes of me being in the room, the nurse comes back in and says, "I've got bad news. I just got word that the neurosurgeon that you wanted to see is at the hospital right now. He just finished up his first emergency surgery, and he's going into his second one. And the other neurosurgeon that you typically see is out of state for a residency conference." I was like, bummer. I was really hoping to see a neurosurgeon I come from Atlanta and we literally fly out tomorrow at 5 p.m. Is there any way I could be seen in between now and 5 p.m. tomorrow? She says, I don't know, the neurosurgeons are very busy, and the other guy that you typically see isn't coming back from his residency conference till the end of the week. And scheduling coordinator is made aware of the situation. And the scheduling coordinator knows that we come from out of state. And just as an FYI, I understand that there's a healthcare worker shortage, whether it's nurses, doctors, specialists, etc. But this clinic is capital P phenomenal, and they will bend over backwards to do anything it takes for me to get seen by somebody before I fly home, because they know I come from out of state. But this nurse had no idea that I was coming from out of state. I met with urology, and my kidneys look fabulous, and my bladder, I'm not able to hold as much as an able-bodied person, but that's common for people with spina bifida. And I have neurogenic bladder, and with my neurogenic bladder, I get a lot of UTIs and bladder infections. And now, as I've gotten older, those UTIs and bladder infections have been asymptomatic. And I asked my urologist why that was, and she said that it's because I've had so many bladder infections and UTIs that my body's gone numb and has stopped showing symptoms. But she said, as far as she could tell, those UTIs and bladder infections are not damaging my kidneys. So that's a good thing, because we don't want that. Because it is very common for individuals with spina bifida to have kidney issues. She still wants me in pull-ups, and as far as my neurogenic bowels, I'm constipated, and we are upping my Miralax, and they said, you know, the more constipated you are, the more pee accidents you have, and we're going to up my Miralax to help with the constipation and see if that'll help with reducing my pee accidents. If that doesn't help, then I may have to up my bladder medication. However, I have attention deficit hyperactivity disorder, and the bladder medicine I'm on reacts with my ADHD med by increasing the effects of the ADHD medicine. So I gotta talk to my psychiatrist if we were to up the medicine, which I don't have to make a decision about that now, but that's a big girl decision that I'll have to make down the road. We were in the process of trying to get Miralax covered by insurance, which, spoiler alert, I was able to. So for any of y'all that didn't know that, now you do. And we are in the process of trying to get pull-ups covered by insurance as well, because right now I'm paying out of pocket and would like to get them covered by insurance. The urologist wants to see me in 1 year. Then physical therapy, occupational therapy, and the scheduling coordinator come in. And the scheduling coordinator talks to us, and she says, are you guys available at 9:30 in the morning tomorrow? When do you guys fly home? And I'm like, I'm available at 9:30 in the morning tomorrow, and we fly home at 5, and my last appointment of the day is at 1:30 p.m. with the physical medicine rehab doctor. And she goes, great. If you guys are available and would like to, I'm able to get you in at 9:30 in the morning tomorrow with the neurosurgeon that you were supposed to see today. Do you guys want to take the appointment? And we're like, heck yes, thank you very much. So there was that, and she left. And before I get into this, I ended up seeing 2 different OTs, because the OT at clinic forgot that she was meeting with me and didn't have a ton of time, so I ended up meeting with her friend the next day. But I'm just going to combine what they both said into one to make it easier. But basically, with physical therapy, I showed her my home exercise program, and it was way too much, so I only am going to pick 2 exercises to do a day, and that's made it easier and more manageable for me. And she said I'm not going to make any big gains, I'm only going to make small ones, which I kind of expected, because I haven't been really making any big gains ever since I became an adult. For instance, a small gain that I made, so this time and last clinic, I had to stand on one leg while holding my PT's hands and everything, and Last year I wasn't able to do it at all, and this year I was able to do it for 5 seconds. Pause. So I'll talk about some of the big gains that I may not be able to do, but some of them are I'm not going to be able to stair climb and alternate feet 100% of the time, as well as walking without getting fatigued, just to name a few. So my efforts during physical therapy in Atlanta are working. And another thing is that my left foot was clubbed, but now the club foot is almost all gone. The club foot has almost completely resided itself through stretching, which is a phenomenal thing because that means that I'm not going to need casting or braces or even surgery for it. So, again, that's phenomenal. And then she wants me to get PT done in Atlanta twice a week or just based on whatever my PT in Atlanta wants me to do. Occupational therapy. So, we talked about like the kinds of things that I like to do and just what I do during the day. And I told her I love to bake, and I told her that I fatigue when I walk and stand. So she told me that energy conservation is going to be key, and she wants me to be able to sit and do things instead of standing all the time. And we are looking into other ways for me to get around, like a wheelchair, but I'd only be using it for distance. And there are people out there. I'm only going to be using it for distance and stuff. And I told her that when I have a tub shower combo in a home and it's hard for me to shave my legs in the shower. So I'm looking into getting a shower chair under her recommendation. And I don't like the OT that I have here in Atlanta because she wants me to work on handwriting, and thing is that my hand gets tired when I write, color, and cut, and I already have adaptations by typing, scribing, or using speech to text. But again, this OT wanted to push handwriting. I asked the OT up at clinic if I should continue to see this person, and she said no and to find somebody else. So I'm in the process of looking to try to find somebody else. She also said that typing, scribing, and speech to text are completely okay to use. And as far as the issues, like the challenges with coloring, she recommended some color by number apps on my iPhone, and I've downloaded those and I love them. And I will try my best to link those in the description box for y'all to use as well. I have an iPhone. I don't know if they're available for Android. That's something I'd have to, look into at a later time. So then the researcher comes in. So this clinic is a part of the Spina Bifida Association's National Patient Registry, or NPR for short, because you're going to hear me say that a lot. But basically, they've picked a handful of clinics in the US to participate in this. And every time I go to clinic, the researcher asks me the same exact questions. And then afterwards, she inputs those questions into the NPR. And the Spina Bifida Association gets grant money from the CDC, and they figure out how to best allocate funds and everything from the CDC through the NPR. So it's kind of like, let's say you like coffee for the first time and you want to go out and buy your own machine. If you are smart, you're going to do your own research instead of buying something on the fly. And this way, when you do your own research, you can find out what bells and whistles you like and need and what you don't need. Same thing here. Then social work came in and we talked about getting everything approved by insurance. And she also said at this point, because I wanted to get a full-time job and I was going through vocational rehab when I got back in Atlanta to make that happen. And the researchers said at this point that with all the therapies I need, because OT wants to also, when I find one, she wants me to see them twice a week or whatever the OT, down in Atlanta says. And she said at this point it's best for me to go on disability and to gain a part-time job. So she also wants me to get Medicaid and Medicare because that'll help. Because I can use Medicaid and Medicare as my secondary insurance and still keep, the insurance I have now as primary, but Medicaid and Medicare will pick up whatever health insurance my primary health insurance doesn't cover. Social work also said that I'm doing way too much. And I thought about it, and she's right. And I know why I'm doing too much, but that's trauma that I don't want to unpack right now. With neurosurgery, they came in and they said that there was nothing they could do surgically, and that if they were to open up my back and remove scar tissue, there's going to be more scar tissue that'll build up in there. And I asked about pain medication, and he basically said that, that was a PMR question. So I met with PMR. She confirmed getting everything covered by insurance. She doesn't want me on pain meds yet. And she agreed on the wheelchair for distance only. She said if I were to use it 24/7, that would be detrimental to my health. And they want to preserve my walking abilities. Witlist giving me breaks when I need it, because conservation of energy is key. And taking rest when I need is key. The issue I'm having, though, is it is by law in the US, it is illegal for any healthcare professional, regardless if they're a doctor or a nurse, to practice in a state that they're not licensed to practice in. And my physical medicine and rehab doctor wants me to get my wheelchair in Atlanta. She wants me to get it in Atlanta so that I can build a rapport with a wheelchair clinic there, and because airlines are known to damage wheelchairs. And the last thing I want is to get a brand spanking new custom fit to me wheelchair and have it get damaged on the flight home. And because she is not licensed to practice in the state of Georgia, she can't coordinate my wheelchair fitting like a typical PMR would be able to do. So I had to do this all myself with literally zero guidance. But now I have guidance, and I'll update more on that later because I was able to get some help from some people. That part was a little stressful. So overall, I felt like this trip went phenomenal. 3-year-old me would have been so proud about how hard I advocated to get my needs met. You're probably thinking with the wheelchair, you're not going to use it 24/7, but yet you need a wheelchair. So just to clear that up, a lot of individuals with spina bifida, it is perfectly normal for them to want a wheelchair as an adult. And number two is it is perfectly normal as well for individuals with spina bifida to have multiple mobility aids based on, their needs and everything. And that's it. I thank you guys so much for watching this video, and bye.